Yeah, so head and neck cancer represents a variety of different cancers which can occur both in the mouth, in the voice box, or in the throat, so that the symptoms that patients present with are quite varied. But the common things are a lump in the neck, which is unexplained, which is maybe 50% of patients who get diagnosed with head and neck cancer. Other common symptoms are loss of voice for a cancer affecting the voice box, or soreness in the throat and difficulty with swallowing for tumours of the back of the throat. The other common symptom is something that some patient sees in their mouth. So, for example, a lump or an ulcer in the tongue, which patient might notice themselves or might be picked up by the dentist. So the treatments for the different head and neck cancers at different sites is often a complex decision depending on the site of the tumour. So often, for example, tumours on the front of the tongue where they can be removed easy surgically without that much detriment on the patient's function in terms of speech and swallowing, for example, then surgery is the best treatment. Okay. Other tumours, sometimes small tumours involving the voice box, for example, can be much more difficult, maybe best treated by treatments where the initial organ that contains the tumour, like the larynx, can be preserved. In those situations, treatments with radiation can be favourable over surgical treatments. And for many patients, it's important to have a conversation between the patient and their family, the oncologist and the surgeon, in a multidisciplinary way to really discuss the pros and cons of different sorts of treatment and to come to a decision that's best for that individual case. Typically, surgical intervention is required at the beginning of the investigations to take a biopsy of the tumour. This is really important to help decide on the best treatment. For some patients, if the tumour is in an easily accessible place where it can be removed with little loss of function in the mouth and throat, then surgery can be the definitive treatment as well. Surgery can also be used in patients if they're treated, for example, with chemotherapy and radiation as their definitive treatment in the first instance. If that treatment failed, then surgery has a major role to play at that point. Head and neck cancer is made up of a variety of different sorts of tumours affecting the mouth, the throat, the voice box, salivary glands and other sites. And so the most effective treatment for an individual patient will often depend on the position of the tumour, its accessibility for surgery, for example, or whether chemotherapy and radiation gives the best option, allowing the tumour to be treated in situ without having to remove the organ. So that the answer to the question is what's the most effective treatment will need to be individualized, and it's best given by multidisciplinary discussion with oncologists and surgeons with the patient and their family. So generally speaking, the most effective treatment options for patients with head and neck cancer are surgery and radiotherapy, and quite often radiotherapy is combined with chemotherapy drugs like cisplatin as well. It's certainly possible for patients to make a full recovery after treatments. It will depend on the extent of treatments required, but many patients can be treated and cured for head and neck cancer. In some of the commonest types of head and neck cancer, for example, tumours of the tongue and throat caused by the human papillomavirus, then the cure rates are very high indeed, sometimes in excess of 90%. So patients in that category can have really good confidence of being treated by their clinicians. Other patients obviously are not such good guarantees.